Accessing second molars, ensuring patient comfort, and getting the suction you expect with your Isolite system are all easier than you think. Let's walk through a few tips together. Accessing the most posterior molars and maintaining patient comfort are often connected to bite block positioning and mouthpiece sizing. Instead of forcing access or removing the mouthpiece, try a small adjustment. Moving the bite block slightly anteriorly shifts the mouthpiece away from the distal marginal ridge of the second molars. This allows the patient to close slightly, improving access, just as it does without Isolite. If a patient feels uncomfortable, pause and reassess. Check your sizing and placement technique. Even minor adjustments can make a big difference in comfort. When positioned correctly, most patients tolerate the mouthpiece very well, even those with gag sensitivities. For more sizing and placement tips, check out our video on perfecting mouthpiece placement. If X-rays interrupt your workflow, it's an easy fix. Gently remove the mouthpiece, complete your imaging, and then replace it to continue the procedure. Think of it just like a bite block. If suction performance isn't what you expect, start with a quick system check. Make sure both levers are fully on and placed correctly in the proper ports. Check your tubing connections and positioning. Ensure the lines are cleaned. If you're using the Pro system, make sure the dial is set correctly and clean the power vacuum base regularly. It can act as a trap and reduce suction if not maintained or turned to the correct position. These challenges are common and completely fixable with the right technique. It gets easier with practice and learning. Explore more detailed tips and maintenance guidance in your Isolite online learning program. Click the link below for access.